The surgery project started many years ago. Our goal was to make it the most efficient operating room possible. And in order to do that, we looked at a concept of any room, any procedure, any time. What we can do with this new operating room is improve the quality of our patient care. We do a great job now in a small space. And so by opening up this space, it just makes a better work environment for everyone in the operating room. But it also creates a more inviting, more healing environment for our patients when they come into a space that's new, it's bright, it has all the things that they need to make sure that their experience here is the best it can be.
Patients, from my point of view, pretty much are all why we're here. We all work as a team to give them the best outcomes and the best care we can. And the happier they are, the happier we are. I think it's going to tremendously impact patients' experience all the way from the preoperative area and the transitions into the operating room where there's more space and families being able to be around the patients more as they go through stressful times.
The surgical setting is pretty important just because it provides us with enough equipment and tools so that we can actually do our job efficiently. If you have an operating room where you have good flow of the entire case, which includes the team as well as the surgeon, it just makes the surgery more successful.
The size of the new OR is approximately double of what our old ORs were. Each room is just over 600 square feet, where our old rooms were 400 square feet, so about 150% bigger than they were before. So that allows us to advance with the new technology. Any new technology that comes in, we know we have room for, we know what we have capability for, and we've developed that in our strategic plan for building these operating rooms and having them take us into the future.
Technology used today is completely different from 1968 when the old ORs were conceived and developed. Some things have gotten smaller, but in the case of the hybrid room, some things have gotten larger. When you incorporate imaging into the actual OR theater, it takes a lot of space.
So traditionally, vascular surgery was done with an open surgical technique, incisions on the body, bypasses or a repair of an artery. Now with the advent of endovascular surgery, we can travel again within the lumen of the blood vessel. A hybrid suite allows us to do both at once. Traditionally, patients had to get an open procedure, go home, recover, maybe get an endovascular surgery later. We can do all of that at once now. Because the imaging technology is so good, we have more precision in what we do, where we place stents. From a patient standpoint, again, the smaller incisions, less recovery time, less pain, earlier to work, better meaningful life recovery is what patients see.
It's hard for me to envision what the next breakthrough in technology will be, but we have tried to think of everything possible and incorporate it into these rooms so that if structure needs to change, the supports are in the ceiling. IT changes, we think we have the infrastructure set to accept those types of innovations.
It's really amazing how it comes together, where you have the construction workers, the physicians, and the nurses all working together to make this happen. And to make it happen with the patient focus.